If you want me to describe to you a typical patient journey for a head and neck treatment, at the Cromwell Hospital, I think the first step is going to be a meeting with the surgeon or the oncologist to assess the patient, discuss treatment options, and organize the necessary tests that are required. Once the results are available, the results are discussed within the multidisciplinary team meeting, where actually the appropriate treatment plan will be put in place and discussed and agreed upon by every member of the team. Then the treatment plan will be further discussed with the patient and agreed. We obtain the patient consent. In my case, it will be chemo and radiotherapy, for example, or radiotherapy. Once I obtained a detailed consent from the patient, then the process starts. Head and neck treatment require very accurate positioning of patients. So that would involve the use of a thermoplastic shell, we call it, to really minimize any movement the patient may have while they're having the treatment on the machine. We'll also get their teeth checked to make sure there are no dental problems. They will meet the dietitian, they will meet the speech and language therapist before we start. Then we obtain a CT scan of the head and neck area, where detailed mapping of where the tumor is, where the healthy tissues that we need to protect are, and then that will be verified and checked, and then the patient will start the treatment. Once they start the treatment usually is a Monday to Friday. Treatment time roughly is about half an hour in the center. We do follow the patients up every week to check they are coping with the treatment. We can manage any complication or side effects they have and actually provide them with a safe journey through the treatment. They're also assessed for dietetic requirement. They're also assessed for any exercise that are needed to help the swallow or help opening the mouth. And sometimes we require feeding tubes to ensure the patient is adequately fed and hydrated during this treatment, but it doesn't have to be for everybody, and all this will be discussed up front with the patient. A typical treatment will last between 6 or 7 weeks on a daily basis, apart from the weekend, of course.